Hey everyone, this is my public policy health memo for HIV/AIDS in Mexico and their prisons. Okay, the ideal outcome is to reduce the spread of HIV/AIDS in Mexican prisons and therefore make HIV/AIDS a more manageable disease with a much lower mortality rate. Yet this is an enormous task for anyone, especially for this single policy memo. To achieve the objective of reducing the spread of HIV/AIDS in Mexico's prisons, Mexico must consider all the options. It's important to look to other countries that have successfully implemented HIV transmission reduction programs. In the U.S., the HIV/AIDS rate is on the decline, according to the Bureau of Justice Statistics. From year-end 2010 to year-end 2015, the number of male prisoners who had HIV declined from 18,510 to 15,920. The number of females who had HIV declined from 1,780 to 1,220. The prison population in Mexico has a fairly low rate of 0.7% infection. Among the population of prisoners, around 2% are known to be infected with HIV. The overall objective is the reduction of HIV/AIDS, which will be aided by the implementation of successful programs by Mexican prisons, similar to successful programs in other countries' prisons. There are many opportunities and challenges in fighting the HIV/AIDS epidemic. Highlighting the HIV/AIDS epidemic in Mexican prisons is important to the entire Mexican population. The country will lower its risk of creating a public health crisis that might damage the entire country by implementing such programs. Addressing the stigma of HIV/AIDS and implementing healthcare programs that prevent its transmission are necessary, especially in prisons. These prisons can be a potential breeding ground for HIV/AIDS, so promotion of healthcare checkups and condom use in Mexican prisons is necessary. Although Mexican prisons have a relatively low rate of HIV/AIDS, another outbreak of the disease is always possible. The World Health Organization estimates that people in prisons are 15 times more likely to be diagnosed with HIV than those who are not in prison. Mexico lacks the superior healthcare resources that the U.S. has, so the threat of an outbreak is always looming. Luckily, basic healthcare needs can be met in most major Mexican cities. Here are the players and perspectives in my policy memo. Since HIV/AIDS is a global issue, each nation is a distinct player with a set of perspectives on this health crisis. But describing all of them could take volumes of pages. My recommended options will not speak to numerous international relations, so I will not attempt to describe the international perspective. The most important players for our context will be the state and local government, NGOs, and the Mexican federal government. In February 2019, the Mexican government said that it would no longer fund civil society organizations. This leaves more than 200 groups fighting the disease without resources for core activities such as HIV testing. Thus, a coalition between state and local governments, as well as third-party NGOs, is necessary to combat the spread of HIV/AIDS. I believe any of the following three proposals could precipitate significant results in addressing Mexico's part in the HIV/AIDS crisis. Option 1 is to petition President Obrador to seek HIV/AIDS medicines directly from overseas pharmaceutical companies rather than from Mexican intermediaries. Option 2 enforces the National Strategic Plan of 2013 to 2018, which identifies 4 key priorities in fighting HIV/AIDS. These are reducing HIV transmissions by ensuring the continuation of effective prevention and treatment programs focused on key populations, eliminating mother-to-child transmission of HIV, reducing discrimination based on sexual orientation, and ensuring better integration of HIV services. Option 3 involves the federal government needing to raise awareness through the media, highlighting the importance of state and local government programs that serve to combat HIV/AIDS. Here are the analysis of my policy options. Option 1 would force President Obrador to consider seeking helping pharmaceutical companies outside of Mexico. Although Mexico has proven mostly adept at combating HIV/AIDS, countries such as the U.S. and the United Kingdom have a superior medical program. These more developed countries contain access to cutting-edge medicine that can help ease the HIV/AIDS spread in Mexico. Treatment with HIV medicines known as antiretroviral therapy is useful for everyone with HIV. An individual's initial HIV regimen includes 3 HIV medicines from at least 2 different HIV drug classes. The acquisition of such drugs from big pharmaceutical companies is important to slow the spread of the disease. Luckily, Mexico's HIV/AIDS rate is on the decline and not the country's #1 health issue. Okay, on to option 2. Option 2 would enforce the National Strategic Plan of 2013 to 2018. This plan identifies 4 key priorities in fighting HIV/AIDS. These 4 priorities are necessary to help in reducing the overall spread of the disease in Mexico. The plan must be reinforced at the federal, state, and local level to effectively stabilize the spread of the disease. Fortunately, Mexico has a national policy on HIV treatment and has been providing universal access to antiretroviral therapy through the national health system since 2003. The Universal Access to ART program ensures a predictable supply of antiretroviral medicines and tests people without Social Security. Mexico must continue its multifaceted approach towards fighting the virus. By doing so, Mexicans from various socioeconomic backgrounds are able to fend off the spread of the disease. The government must continue to enforce this national strategic plan so that public awareness of the disease spreads. Option 3 reiterates how through the media, the federal government can articulate its message on combating HIV/AIDS to the state, local governments, and the public. The media and federal government are most powerful in swaying public opinion on issues. Both entities can work hand in hand to articulate how the public can take certain steps towards fighting HIV/AIDS. These steps can involve mandatory and monthly HIV/AIDS testing, condom usage, and use of ART drugs if someone has a positive HIV/AIDS diagnosis. The media and federal government are the most powerful in advocating for positive health reform and change for the Mexican people. Recommendations from these entities will influence how local and state governments implement public health policies. Local and state governments often take their cues from the federal government and media when it comes to shaping effective public policies. Here are some of the implementation and recommendations. I recommend option 3 as it will prove most effective in raising awareness to combat HIV/AIDS. The media and federal government hold the most power, with exception to the Catholic Church, in swaying public opinion and policy in Mexico. Local and state governments listen intently to discourse on health-related issues from these powerful entities. If the media and federal governments enforce mandatory HIV/AIDS testing or ART usage for those infected, then the state and local governments will follow suit. Raising awareness on how to fight HIV/AIDS through the media and federal government is key to influencing how the public reacts to the disease. Option 3 will raise awareness to Mexican people throughout the country and could help eradicate the overall prevalence of the disease. All right, that is my entire policy memo. Thank you all for listening.